How do you attract new clients?
So a lot of our,
Besides with your arms.
yeah, right. Yeah. So I will say, and since you brought that to the
Can you
attention.
talk about your arms?
No.
No.
You are your resume. Your body is your business card. Be a representation of your business. Like you're like, hey, I own a health nutrition store or I own a fitness business, right? And you don't look like you work out. You're not a very good business card for yourself. So when I walk around and I wear my shirt and the back of my shirt says, does your PT even lift? You better look like you fucking lift. Yeah.
Did you think this podcast is going to get all emotional and feely?
No, I love it. Because you know what though? Like this is all part of it in terms of the business stuff. Like the conversations that you have, most of the conversations are about the relationships that you're going through.
If you're considering toxic masculinity being somebody that insults people, hurting women, you're not masculine, you're an asshole.
That's right.
Right? That's not toxic masculinity.
That's right.
Masculinity to me, I'm going to take care of the people I'm with. I'm here to help you. That's being masculine. All right, so Dr. Chad Burnham, welcome to Becoming a Better You podcast. For those who don't know, we went to PT school together. And yes, he was this giant in PT.
No, I wasn't.
I don't know how I'm going to handle this because like I have been on a podcast with people who have bigger muscles than me, but I'll do the best I can. Not used to being smaller, muscle-wise. So we're in Salisbury, Mass?
Salisbury, Mass, yeah.
Almost near New Hampshire.
Almost. We're on the line.
Yeah. So
Yeah.
this is the longest we travel for a podcast. And I say we as I have more personalities than myself, but super excited.
Yes.
So you're a physical therapist. Obviously, I think you work out.
Yes.
What else?
Oh, yes. So like in terms of hobbies or like in terms of the business?
Yeah, both. What makes up Dr.
Yes.
Burnham?
So I would say that my biggest hobby, obviously, besides work, is working out. I always schedule time during my day.
Priority?
Priority. It's priority number two. Priority number one is family. Priority number two is definitely the business. Priority number three. So we close the clinic down 2 hours every single day, Monday through Friday, because we're not open on weekends. And everybody gets to work out. So it's like the culture that we have here. So I'll go next door and work out and get out of here, you know.
Do they want to work out next to you? Because I think I might be even a little intimidated.
So it's funny because my other PT here, he's into strength training, but he's not into he's into hypertrophy stuff, but he's more into like endurance, like kind of speed stuff.
Would you try to say he's skinny?
No, actually, he's put on a lot of weight. But what I will say is it's not my cup of tea. So when they always want me to do stuff with
You
them,
don't
it's
look like a long distance runner.
no, I don't do. I am like the anti-cardio guy, you know.
Do you think that you need cardio to actually burn out fat?
I don't think that's true at all.
Correct. I would assume correct.
Yes.
Right.
Yeah. I do think it has its place, but I don't think, and there's obviously different forms of cardio, right? But I think it has its place, but I don't think that you need it. And I've proven that. I have a very strict nutrition regimen, right? So I think if your game is on point, then you don't have to do cardio every single day, you know?
And as physical therapists, we are saying cardio does have its benefits.
Correct.
But we're just talking about fat loss.
That's correct. Yes.
We don't do much cardio.
Yes. No, and I should, right? Like I know cardiovascularly is beneficial for me, you know?
But
would I do it for weight loss? No.
Right. Exactly. All right. So go back to, this is how the podcast is going to go. All right. So the things that make up you. So family,
Yes.
business, fitness,
Correct.
you know, any hobbies?
I ride motorcycles and stuff, but other than that, like I'm a pretty boring guy, you know what I mean? And I'm cool with that. Like I enjoy it. Actually, my biggest hobby is work, you know? We built the business over 7 to 8 years and it definitely consumes a lot of my life, you know? And, but I enjoy it. I do. It's not work, you know, it's not.
Because it's a passion.
It's a passion, man.
So then why do you love physical therapy?
So I love the direction that it's going because I can move it in the direction that I want, right? Like I don't view physical therapy as this traditional model of physical therapy. Like we've changed our model so many times that
Are you talking about you personally or the profession?
me personally. No, I would love to move the profession in a different direction.
Do you feel the profession stuck?
I do.
Yeah.
I feel that more awareness is moving it forward in a direction that it needs to go. But I feel like some of the older traditional physical therapists are kind of holding it back, just like, you know. I think once we get to that point where people can see the capability of what physical therapy can actually be, then I think that, you know, it can move in the direction it needs to. you know?
And what direction is that?
The direction that I see it going is creating a model in which it's almost like we're becoming the primary care providers. You know what I mean? Where people can come in and not only get their physical therapy, but we do training here. We have conversations over nutrition, sleep, recovery. My main PT is into functional medicine. So it's like we're talking about all of these things where it's like it creates a whole health approach. You know what I mean? Not just physical therapy, like, hey, my shoulder hurts, let's treat your shoulder. It's, oh, my shoulder hurts, plus I'm also lacking motivation, and plus in this and that. Like, I've had patients now that we have affiliations with lab companies, and we have them get lab work done, right? And I've had a couple of guys that are now on hormone replacement therapy because of that. And they're not only feeling better from a physical therapy standpoint, but from a whole life standpoint. You know what I mean?
Yeah, I think that one of the biggest things that I saw when I was a full-time physical therapist, I work with chronic pain patients.
Sure.
Right? So that pushed me in a direction to not be traditionally what a PT would be, because they've already seen 3 or 4 PTs.
Yeah.
They've had surgery. None of it worked, because
Yeah.
you're still seeing me
right.
as like, pretty much one of the last therapists you're going to see. And it pushed me into like myofascial release. It pushed me into like trigger points. It pushed me into things that I wouldn't have seen if I was in a traditional clinic.
Right.
Then you go to me having a full-time fitness transformation studio, and then be like, okay, listen, like, so obviously we know everybody needs to move to heal, but there also needs to be a nutrition component, because
Yes.
if you're inflamed, everything else is going to hurt. But the bigger piece is the accountability,
Yes.
right? Because if people aren't accountable, they're not going to do it, not going to do that stretches. And I feel like, so the way we do it in our fitness studio is they have a coach that's assigned to them that even checks in with them outside of the studio.
That's awesome.
Right? So the only way you can really fail my programs is if you ghost me,
Yeah.
right? But in PT, you have them, okay, so I always tell people like, cool, so like I'll see you for, let's say 3 times a week
Sure.
for an hour, that's 3 hours. There's 24 hours in a day. So like if you don't keep this stuff up on your own, there's not much I'm going to do in those 3 hours a week, right? But no one checks in with them. No one's like, hey, Susie, are you doing your exercises? Dr. Chad wants to know.
Yes. Yeah.
Right?
Yeah.
And they come in and you can tell, I would probably say 80% of my patients didn't do them at home.
Yeah. Of course.
Right?
Yeah.
So it's more that holistic model.
Right.
Right? And then you throw in the lab testing. I did the DNA test through Grant Cardone's company.
Yep.
10X Health.
Yep.
And it gives you the mutations in your genes.
Yes.
And then they pair it with what supplements you need to take.
Yeah.
Right?
Yep.
Which was super cool.
Very cool.
For me. And
Yeah.
a lot of that was like digestive issues cause all these other issues.
Yeah, it seems like that's the way that a lot of things are going too. Like I had a patient that owned this company called Ixella, and that was what they did. They did blood testing and then determined what metabolites are in your blood to determine what supplements might benefit you. And this is all based on like how like your gut is reacting to whether it's inflammation or whether it's like certain foods that you're eating, right? So it's pretty interesting how everything is kind of coming around and people are starting to kind of see this more and more,
Yeah. And so what's the resistance? Because I think from what I remember, like in the military, the PT was the triage,
Yeah.
right? You'd go to the PT first and then they'd send you where you needed to go.
Right.
Kind of what you want to do in the normal population.
Yes. Yeah. And I think that all depends on what state you live in too, right? Like we are very fortunate in the state of Massachusetts. We have unrestricted direct access. Like people can come in here off the street, not need a script, number one. Number two, they don't have to check back in with their doctor after so many days. So it's like we have the ability to literally see these people forever, you know what I mean? And not have any restrictions whatsoever, which is fortunate for us. And I think that will, carry forward in more states. I know some states have more of a limited direct access. I don't know how Rhode Island is, but
When I left, it wasn't that direct.
yeah.
Let's just say there was access.
Yes. And honestly, like I live in New Hampshire, and that was the main reason why I opened up my clinic in Massachusetts, because of the unrestricted direct access, because I saw the vision that that's what I wanted,
What do you not like about the PT profession?
That's a great question.
PTs there, but it's okay. We're talking truth.
Yeah, no, totally. I think that the one thing that I really have a hard time with is a lot of people kind of go into it. It's a job, right? Everybody gets the same shit, and I think that needs to change.
As far as like people becoming PTs?
As far as how people are treating patients, how people you know what I mean? How they're diagnosing certain things, how they're, treating certain issues, right? I think that obviously insurance plays a role with this. I know that the big corporations play a role with this, like where you're restricting people's time. You can only see people, for X, Y, and Z. You can only treat them for this amount of time, number one, or hey, you can only do this type of therapy because this is what we get reimbursed the most for. So this is what you have to do. You know what I mean?
Isn't it crazy how somebody who doesn't know the patient can dictate how many treatment sessions that you can have with them without even knowing mentally where that patient is?
Yeah.
Right? Because every patient is different. And if you have an optimistic patient versus a pessimistic patient, like the optimistic patient, yeah, they might get better in those 12 visits. But the one who's smoking and has like the Eeyore effect and like just what was me?
Yeah.
As a PT, we need to unravel that onion for them to get better.
Yeah.
And that could take 30 visits.
Yeah.
If at all, right?
Yeah. Right. And I don't blame a lot of the providers for this. I get it. People get stuck, right? I was there. I know how it feels, and I think that you have to be aware of the fact that, hey, you're stuck. And if this is what you really want to do and you really want to help people, you need to get out of the situation, whether it's you talk to your boss or you find another job where you can actually, quote unquote, help people, because you're not helping anybody by spending 15 minutes with them and then throwing them in the corner. Like, how many people do you have that come into your clinic and they're like, yeah, man, they just threw me on the bike and, I was left there for like 15 minutes.
So I would hear that a lot.
Yeah.
I think a lot of times too that, and I've said this before when I was a PT, like, I can talk nonsense all day long.
Sure.
Take their mind off the pain.
Yeah.
Talk about something else, make it light, and give them some manual work.
Yeah. Yeah,
right?
Of course.
But no, speaking to that, like towards the end, like I started to know that, like, listen, I could have more of effect and help more people by going this route. Mm-hmm. Obviously, I didn't know about the podcast, but like doing the jujitsu, which turned into the fitness.
Yeah.
Right. Because I was burnt out, and I definitely felt like restricted. I also felt like, I was drained because like,
sure.
Okay, so your caseload 15 people in the day, you'd fix 10, 5 more come in, right? And for me, being so in tune with like my feelings and how I feel, like, and I care about people.
Yeah.
If I didn't care, wouldn't matter.
That's right.
There's your 5 exercises that everybody gets for that low back pain.
That's right.
That I was like, for my own mental stability, I need to get out of this.
Yes.
Right? And it was nothing against the patients. It was just, I knew that I had this other outlet. Sometimes like, where you are, where you want to go, and this isn't the vehicle.
Yeah.
And I remember I think it's always important to follow your passion. And people would be like, you went to school, got a doctorate. And I was like, yeah, I didn't forget what I learned. You know what I'm saying? Like, all of a sudden I'm like, man, I don't remember anything.
I think it's great that you created that niche for yourself though. Like between physical therapy, fitness, and jujitsu, I mean, what a niche, I think it's awesome.
Yeah, it definitely helps.
Yeah.
Especially for people who want to get fit and they've been through physical therapy or have had joint replacements.
Sure.
Like I tell people, one of the reasons why people will bust on me online, which is fine, is like the women won't be doing the strikes correctly in the fitness kickbox.
Sure.
Okay, cool. So like diabetes doesn't care about your hook punch, right? Like it don't matter.
Yeah.
As long as you're moving.
Yeah.
But I'll have people come to me and they'll sit down in a chair and punch a bag.
Yes.
Right? You wouldn't be like, hey, cool. So you can't walk. So don't even try. Just sit in the recliner, put on the TV, right? You'd be like, okay, so sit down when you need to, stand up. And I think, and I'm unrestricted, right? Because there's no insurance.
Yes.
And people pay money.
That's right.
Which we're going to talk about for you in a second.
Yes.
Because people vote with their dollars on things they care about.
That's right.
Right?
That's right.
And I think if insurance is restricting what I can do with them, or if insurance is paying, people don't care as much.
Yeah.
Right?
Yeah.
That's why free things don't work. Right? But talk to me, because you don't take insurance in.
That's right.
And I know there's a lot of people, I shouldn't say a lot, but I know there's some people that I know in the profession that would love to not take insurance.
Yeah. Yeah.
So how is that different? How do you attract people?
Sure.
Like you have to market now?
Yeah. So I think the biggest amount of feedback that I get, especially of kind of going toward this model, is you're always going to have people like, oh man, that's so awesome. Then you're going to have people that are like, yeah, but you can't help everybody. It's like, I understand that. I get it. Yeah,
What do you mean you can't help everybody?
So not everybody can afford your service. You know what I mean?
But there's other options.
That's correct.
Yeah.
That's right.
I tell my people, like in my studio, like, you want to be a Porsche dealership.
Yeah.
Not everybody can drive a Porsche.
That's right.
But those are the clients that you want.
That's right. That's right. That's right. So, and I've been in both models. I've treated everybody, and now I've treated, the patients that I'm treating now. And until you've been in both models, you can't have that conversation with me. You can't, because you don't know how it feels. Because I would have to go every single week knowing that my cancellation rate was going to be about 30 to 32% every single week because of what you just said. It's just physical therapy. Screw it. I don't have any skin in the game. You know what I mean? Like, if I don't show up, who's going to charge me? Nobody, because I can't charge your insurance company for that. They don't care. You know what I mean? And now it's less than 7%. Our cancellation rate is less than 7. Our no-shows, it's like 0.5.
Because they're paying.
They're paying. And they're involved, not only financially, but like mentally, like physically, like they're ready. You know what I mean? They're at the point, like, we get a lot of people that come and see us that have already tried all those options, and this is their last resort. You know what I mean?
Are you more like a concierge model where they have to keep paying you and then they can come to you, or do they buy like sessions?
Yeah, so it would be, we have like single sessions. We also have packages. We also have like continuity programs, which is basically like a month, for a certain amount of months. We also offer the training, though, which is where we get most of our patients that will transition from PT to training. So we have this funnel, if you will, right? And the funnel starts with physical therapy. Ideally, it's physical therapy. They go to training, like one-on-one, and then they go to small group training.
Okay.
So that's like how we try to not only keep them in the ecosystem, but it also benefits, you know what I mean? Because there comes to a point where you don't really need all of the physical therapy. Like, you don't need the manual stuff. You need exercise. You need to keep on just going, right? We need to kind of push you a little bit more. That's where the training comes in.
Or have a coach to see what you now need.
Correct.
Right?
Yeah.
And I think
exactly.
That's the thing.
Exactly. Yeah. And then they get to the point where they're just like, all right, I'm doing really, really good. Now, I want to keep on going, but maybe I want to do it like only a couple of days a week with like more people. It's like more affordable, right? So we transitioned to small group training. So it works out great. And honestly, like we love our patients now. It's amazing.
How do you attract new clients?
So a lot of our
besides with your arms.
Yeah, right. Yeah. So I will say, and since you brought that to the attention,
talk about your arms.
No.
So it's going to be the teaser, right?
Yeah.
There. There's a teaser.
So you were saying, so you brought up, all right, my niche is physical therapy, jiu-jitsu, and fitness, right? Like, and you have a background in jiu-jitsu. Like, it's very clear to say, hey, I want to go see Marc. He knows what he's doing, right? You're going to come to us. Like, our niche is working with active adults. Like, that's our niche, right? Like, yeah, we have some older patients. We have some patients with Parkinson's, like post-stroke patients. Like, we still see post-op, ACLs and all that other stuff, right? But most of the people that are coming to see us are like, wow, these guys look like they actually say what or do what they say. You know what I mean? Which is the reason why we're so good at what we do. You know what I mean? So when I have somebody that comes in and be like, yeah, I want to work with Chad, or I want to work with Nick, you know what I mean? Because, I want to be in good shape, or, they motivate me or whatever, right? Like, I attract this clientele. There's no doubt, right?
Do you think looking like that helps?
Of course.
Yeah. So I won't mention any names, but I know a classmate of ours.
Yeah.
She commented on one of your...
I love her to death.
Yeah, she's a great person.
Yeah.
She commented on one of your posts.
Yes.
About,
you are your resume. It's basically your body is your business card.
Yeah. So what was she basically saying? Because I don't want to miss.
Yeah. So basically the post that I put out was be a representation of your business. Like, when you wear your shirt, it's also underneath the shirt as to what you're representing. So if you're like, hey, I own a health nutrition store, or I own a fitness business, right? And you don't look like you work out, you're not a very good business card for yourself. Do you know what I mean? Mm-hmm. So when I walk around and I wear my shirt and the back of my shirt says, does your PT even lift? You better look like you fucking lift.
You have credibility. You have credibility.
That's right. Yeah. That's right. So, and I wasn't saying it in a negative way. I was just saying, like, unfortunately, that's just the reality. Like, when people look at you, they want to feel motivated by you, right? And it was, and we had this conversation back in PT school, so I already knew it was going to happen, and it wasn't just her.
She got triggered.
Oh, totally. Yeah, totally. And you know what? Like, and in her defense, like, she crushed it. She lost a ton of weight, right? And, it kind of came back, and it is what it is, right? Like, it happens, right? But I said, and she was nice about it, right? But then I came back at her and I said, you know what? I've seen what you're capable of. Go back out there and do it, right? And what do you think happened the next day?
Did she go and work?
She changed her profile picture to what she used to look like. And I was like, you go, girl. Like, that's it. That's what I want you to do. Like, take it as positive feedback. Go crush that shit and go do it. You know what I mean? Like,
So there's
You
always
know?
two paths in life, right?
Of course.
There's like, you have the path where like, here's where you are right now.
yeah,
You want to go be over here,
that's right.
right? You need to see somebody who's already over there
Yeah.
to know that's an option,
That's right.
right? Or you don't make any changes, you go down this path. So I never think somebody can't be, insecure about themselves if they're on their path, they're on their passions. When people get mad about that, that's just because they see the contrast and they choose not to go that way.
That's right.
So people like you are actually like posts that, oh my God,
Yeah.
you can get that big?
Yeah.
You can work out? Yeah. There might be people watching this who want to be a PT, who think they can't. And they see you and they're like, I can be a PT,
Yes.
right? And I believe that, listen, leaders always have arrows in their backs,
That's how it goes, man.
right? 100%.
Part of the deal.
Yeah. So I think that if you are true in who you are and what you want to be, you have to walk that path. Because if you don't, you do everybody an injustice.
And it all depends on what you want to get out of it, right? Like if you have made that decision where you're like, hey man, I'm going to go do it. I want to motivate people. I want to move in this direction. You have to be ready for the negativity. It's just going to happen.
Yeah,
you know what I
especially
mean?
with the internet.
1000%, man. So like, and I always say too, like if you don't have haters, you're not doing it right. You know what I mean? You're obviously doing something wrong if you don't have haters, because not everybody's going to love you for some of the things that you either say or do, because maybe they're jealous or they're not confident or they're insecure with themselves, whatever it may be, right? But I don't think about the people that hate on me. I think about all the people that I'm motivating. Because how many people do you get that are just like, oh, dude, I want to be you are making me want to be a PT. I get it all the time. They're just like, oh, I want to be a PT just like you. I'm like, cool, man. Like, it's not just as glorious as just posting shit on Instagram, but if it motivates you to kind of get to that point and feel that passion, then let's go. You know what I mean?
Yeah, like I always want to just work out near the lake and just do this. I'm like, Chad's update.
Yeah, that's
I really think that we put all this stuff out and stuff like that.
Yes,
And I've gained business from the podcast.
Yes.
I've lost business from the podcast.
of course,
But you have to be true to who you are,
1000%.
right? And I think that's the biggest
I
takeaway.
say that all the time.
So when we talk about clients, what do you see are the characteristics of what client that gets better and a client that doesn't get better?
That's a good question. Yeah,
A podcast host.
yeah, I know. It's a good question. It really and I think it does depend on the provider too, right? You have to be able to read the room. You have to be able to read the patient well enough to know how to push them and to know how to get them to where they need to go. Because not everybody's ready for it, I do believe though that the ones that are doing well are the ones that are like truly motivated. And I do believe that it all depends on like the model that we have here. I would say that 99.9% of our patients are doing better. There's like that 0.1 where it's like, yeah, I'm just coming here just cause,
Would you say it's fair you can't teach desire?
can't do it, man. Like you either have it or you didn't. But I do believe that and this kind of goes back to what creates a good physical therapist is you have the ability to motivate and push people and, I have patients, dude, that like, I don't even touch sometimes. I have this one patient and she will sit there and talk to me for a full hour and she feels amazing when she leaves. The therapy session. She knows it, right? But if I don't have the ability to be able to talk to her and get her feeling good up here, she's not going to feel good physically. There's a mental component and a physical component to this job. It's just what it is. And if you don't have the ability to connect people mentally and physically, and you're just like, well, the book says we have to do 3 sets of 10 of this fucking exercise, like that shit don't work, man. It doesn't.
into my head when you said that, right?
Oh, who?
I can't tell you.
Oh,
It was in our class.
oh, I know who it is.
Yeah, okay. I think it's really about fostering a environment
Yes.
that's conducive to healing,
Sure.
right?
1,000%.
Yeah, I think that's the biggest thing. And just from
The
looking around
culture.
here, this is clean, right? Like you're personable, like everything's put away.
Yes.
I'm thinking in my studio, we got like slam balls everywhere. I was like, I got to step this up, But I think that's the thing. And again, this is a healthcare facility,
Sure.
versus like a gym in my case.
Right.
No excuse, but like you have to be like this,
Mhm.
right? Because when they come in, they're going to judge you by everything that's going on,
1,000%.
right? Even the lettering on the doors.
That's right.
Out there.
That's right.
What do you believe is broken in the medical model, and how would you fix it?
What is broken? There's a lot of stuff that's broken. I honestly think that I think that the medical system is broken in the fact that not everybody has enough time to work with people. I think that's like the number one thing. Like if you go to your primary care, you are just a number. You are like going to get 5 to 10 minutes if you're lucky. You know, if you go to a physical therapy clinic and it's a mill PT clinic, you're going to get 5 to 10 minutes if you're lucky. You're not getting the one-on-one divided time that you need, you know? And I tell this to patients all the time, like, you have to be the biggest advocate for yourself right now. The medical system is so bad right now. You're not going to get the care that you need. You need to go outside the network sometimes and get the care that you need. It's just what it is. Like case in point, like my mom had to, she got multiple COVID vaccines, which is another topic of conversation. But I know we talk about this all the time. We talk about this all the time.
It was great.
Yeah. I'm not going to go down the rabbit hole, but either way, when she got the last one, she felt a lot of dizziness, a lot of, vertigo. She had high blood pressure symptoms, right? And every doctor was like, oh, this is not what it is. It's not what it is, because I think the whole medical system is kind of brainwashed into this one lane. And for people that go outside of like their comfort zone or are kind of going against the grain, if you will, they're kind of like bastardized in the medical field. Like I'm bastardized because I don't take insurance. I'm bastardized because I do like high load training, volume training, and I, don't do a lot of ultrasound and laser and all these other things. And I'm not bashing that. It's not my thing, right? But I think that when you go, like you said, you got to be true to who you are, but also like you have to kind of go against the grain a little bit. You have to go outside the comfort zone. And I think a lot of the medical profession is like still stuck in this traditional type of treatment. And that's just the reason why it just gets stuck the way it is. It's not improving.
Yeah. And I think there needs to be a switch to preventative medicine versus
totally
like reactor.
Yeah.
Right. Like again,
let's
learn
treat it after it happens. Not before.
Let's learn self-defense before we need to use it.
Yeah. Right.
Right. Not after we get attacked and then try to like, but it's the same thing. So as a friend, if I wanted to heal from an injury, or I'm injured, what nutritional advice would you give me? Now I say as a friend, this isn't medical advice.
Yeah.
I'm just a friend. I'm like, Chad, like, my shoulder's hurting. Like, what do you tell me nutritionally? Is it protein? Is it like anti-inflammation diet?
Yeah. So, there's obviously a lot of different ways that you can go with that. I think that a lot of people will, and I'll kind of go off topic just for a second, because I think a lot of people, especially in the fitness community, they'll say, all right, I just need to train harder. I need to do this. I need to do that. And they skip everything else that's like super important, right? They skip the sleep. Because they don't put a lot of emphasis on it, right? Like they don't put a lot of emphasis on recovery. They don't put a lot of emphasis on nutrition, But since you brought up the nutrition key, I think that we do a lot of nutrition programming here. The one thing that we see off the top is people don't get enough protein.
Sure.
It's across the top. Like it's just what it is,
You go like 1 gram per pound.
That's
body
pretty average. Yeah. And I would say that like you could go like lean body mass or ideal body weight, all depending on where that person is.
So for fitness clients, weight loss clients, the number one thing I see for people who lose the most weight is the people who use our protein.
Yeah.
Across the board.
Yeah,
we have other supplements that work great. We have fat burners, but the ones that buy the 2 tubs from me every month are the ones that lose 30, 40, 50 pounds more.
Yep.
Because you can't fake it. I know you've got it.
You can't. And we have an in-body scale here too, where we can measure like skeletal muscle mass. Dude, they're awesome. And it's my lie detector, right? Like, is it 100%? No. But it gives me the trends, and it says, all right, you're either trending this way or you're trending that way. But if you're losing skeletal muscle mass, I can tell right now you're not getting enough protein. I can tell. You know what I mean? So it's a good lie detector test for that in general for me anyway.
How often are you putting people on that?
Like once every 4 to 6 weeks.
Yeah.
Once every 4 to 6 weeks. So like when we do we don't do it a lot with the PT stuff, but with the training stuff we do. So we get a good baseline and then we do like every 4 to 6 weeks just to see where they're kind of trending. But it gives me an idea too as to where they need to be like nutritional, right?
Well, also the protein's going to fill you up.
1,000%.
So you're going to be eating less.
It's a good filler. I'm going through like a little cut right now. So I up my protein a little bit just because I have to. My fat gets lower, my carbohydrates get lower. So I increase the protein a little bit. It keeps me satiated.
And now I just gave you the Prestige chocolate ice cream.
Yes.
Right?
I love it, man. I'm going to eat it.
So people always come up to me because, we sell it.
Yeah.
And like I hate protein. I was like, listen, I don't even like chocolate. And that is the best protein I've ever had. Now, I started with Metric shakes when I was 15.
I know.
16.
I was there in the packets, right?
You weren't with me when I was doing it.
Oh, yeah, but I was your age. With the packets, you can't even get them in the powder. It was like
your dad
be all clumsy. Oh, it was terrible.
My dad made it for me.
Oh my God,
man! I think I just wanted to get
so thick you could barely get it down.
Yeah, it was very thin.
Yeah.
Actually, that's a good point.
Yeah. I think Metrics is one of the oldest supplement companies out there.
Metrics?
I think so. Yeah, I think
They don't really do much anymore.
I don't think so.
I'm telling you, you're going to check out Prestige. I don't know if you...
I am.
Listen.
I'm going to check them out.
Yeah, I went through their training. It's legit.
I love it.
Yeah. And so professional gyms like me who do weight loss transformation,
Yeah.
use Prestige.
Yeah. So we do a lot of Thorne stuff here too, like Thorne supplements.
Okay.
And it's great, in terms of like multivitamin stuff and, glutamine and, and acetylcysteine. We do a lot of that stuff for like, with everything that was going on, plus, inflammatory stuff.
Sure. I don't think people understand how big inflammation is in disease.
Yeah, it's wild.
Right?
Yeah.
We didn't do much nutrition in PT school.
Zero, actually. Yeah. Which is also another reason why I think that needs to change. I think the curriculum needs to change. I've had this conversation with many like students where like they're starting to incorporate it a little bit, but I think also part of it is like who's in the program right now and, how could we better, like when we were in PT school, there was a point in time where we had a PT that would specialize in some area of physical therapy, whether it was like sports or geriatrics or orthopedics, right? And then they would teach that class, and then there was a point where we didn't have any of that. And it was
For us, you're talking about?
Yeah.
Was there a point where we had that kind of? They brought them in, but...
Yeah, right. It was at the beginning. You know what I mean?
Okay.
And I won't mention any names, but there was one professor there that would try to advocate for the profession and tell us about everything that was going on in the profession, right? And he got bastardized and eventually fired.
Yeah.
You know what I mean? Because he wanted to show everybody, hey, this is what PT could be.
Yeah, I really think that, well, this is a great segue because my next question is, do you have any thoughts of emotions on physical therapy school? But I'll get to it in a second. I really felt like there was too much emphasis on book work.
Yeah.
And not emphasis on like how to be a PT.
Yes.
Right? And like, listen, I always said you could have streamlined me into a PT in 3 years.
Mm-hmm.
No undergrad.
Yeah. 1000%.
Right?
1000%.
3 years, you push me out, I'd be a much better PT at entry level than I would be with my 4 years of undergrad, actually 5 years undergrad, and then 3 years of PT school. Right?
Like even nowadays, like I don't go to much PT related conferences. I go to training conferences. What's that?
You're banished.
Well, that's true. That's true. I go to a lot of training conferences.
Yeah.
I get more stuff out of the training. Not only does it jive with our model better, but it's just more applicable to how we like work with patients. You know what I mean? I don't know. It's just 100%. It just needs to go that way.
Yeah. Because eventually, I mean, you get a patient to a certain spot, and then you're switching to fitness.
Yeah.
Right. Once you can do that, you're switching them there. I have one of my coaches. She her shoulder, right? And she's going to PT, and I was like, listen, Rhiannon, I was like, there's no exercise this PT is going to give you except maybe for stabilization.
Yeah.
That you're not doing there.
Right.
So make sure they do the manual work and they stretch you.
Yeah.
Right. Because I mean, you're lifting body bars, you're doing all this stuff. Like, these little bands that you're doing, like you're past that. You know what I'm saying? Like you're not. So like I was like, that's what the PT really needs.
Yeah.
Maybe get your posture. Maybe do stuff like that.
Yeah.
So any thoughts or emotion on PT going through it as
like PT school?
Yeah, as a student.
Yeah, I mean, based on what we just said, I think that the curriculum needs to focus. Well, okay, so if I had to go back and give advice to students in school, I would say that you could be the best physical therapist in the world, but if nobody knows it, it doesn't mean shit. Okay?
Attention's everything.
Attention is everything. But also, you have to, as much as you don't want to be in sales, you're in sales. That's just what it is. You know what I mean? You have to sell your value to the patient. You know what I mean? You have to let the patient know, especially with our model, you have to let the patient know, this is what you're dealing with. This is how long it's going to take. This is where we're going to get you. And then this is where we're going to go from there. They need to know like what the plan of care is, right? It's not just, oh, well, yeah, you've got XYZ diagnosis. We're going to do this, and this exercise. And they don't even know how much longer they're going to be with you. They have no idea, right? Because you're too worried about, passing the MPT exam. You know what I mean? It's like crazy. But I think there needs to be a bigger emphasis on sales and being, like you said, a better physical therapist in terms of all of the characteristics of a physical therapist, not just skills, right?
Yeah, and I think that, there needs to be more of a business aspect.
Yeah.
Like this is how you make money.
Mm-hmm.
Right? Like whether it's insurance-based or whether it is cash-based, like you need to have these skills. You need to understand there's lead generation, there's lead nurture, there's sales, right? then there's fulfillment, and then there's ascension in the different programs.
Yes.
Like you need to have those 5 pillars of your
Yes.
business. Like,
Yep.
I don't, no one taught me that.
No, we didn't get any business in PT school. And
We got some.
okay, maybe.
I think you got in trouble in that class.
I did?
Oh, maybe.
What class was that?
It was a business class.
Oh,
Yeah,
I
see,
don't
this is
remember
why you
taking
got in
it.
trouble.
I don't remember taking
Remember, because I made I had a PT, we had to do businesses. I made a PT bus with a trailer with a hot tub in the back, and I put the people in it.
Yes,
Right?
yes.
I got like an A, and then you did something
Oh,
silly.
my
in trouble.
God.
I was like, how did I not get in trouble?
So
doing this?
ridiculous, man. And you know what my biggest gripe with that whole thing was? Like when we had to do our final projects, and I don't know who listens to your podcast. I don't really care at this
At least
point.
my mom.
Yeah. So we're good then. You had people like Josh. So Josh Clare and I, we ran for the Senate, right? For the school, for our department, right? We created a URI physical therapy program, it was like a pre-PT,
You ran for like Senate for to represent?
the GSA, the Graduate Student Association, I think it stood for.
Okay, who'd you run against?
Nobody, because it was just Josh and I. Like Josh and I were the only ones that ever did it because we represented the physical therapy department, right? So it was each kid from each department of the school, right? Nobody had ever done that before, right? So we created not only the physical therapy, like the pre-physical therapy, it was like a program, you know what I mean? So like all these kids that were interested in physical therapy, they could join that. Yeah, so that was cool. But we also raised $300 per kid to go to the student conclave that year.
I do remember that.
Yeah. And what did we get? We got nothing for that. 0 fucking things. Do you know who got all the praise? The people that built gardens at freaking, the senior center down the road. It's like, are you serious right now?
What did they get?
Well, they just got all they just wow, this is so cool. This is great. And then Josh and I were sitting there like, dude, seriously? We just raised $3,000 to send kids to California for the student conclave, and we're on the student senate, and we created this URI physical therapy program. And it's like, all right, whatever, man. All the stuff that had to get passed that we had to do stuff for that we didn't have to do. You know what I mean?
Yeah.
But I think that's just that's just our school. I know not every school is like that, but that's just an example of the ridiculousness that I experienced in PT school that I wish was better. You know what I mean?
And it might be better now.
It might be.
To be fair, they were going through transitions.
Well, that's true.
Right? So
that's true.
right, we were supposed to have, I remember we were supposed to have a massage class. The person never showed.
Yep.
We never had a massage class.
Yep. Never showed.
So I know they were going through transitions. I think the big thing for me was 2 things, bonding.
Yeah.
Because that's the first time since elementary school that I was with the same kids.
Yeah.
And I really enjoyed that. Obviously, the
Right.
6, I think it was 6 guys,
I think that was it. Yeah.
right? And just the rest women, so we kind of bonded together. I did notice that
We were all sitting with each other in the back, left-hand corner of the room.
but
Everybody was outcasted except for Dave. Dave was the golden child.
I still hear stories.
He could sit anywhere he wanted.
Yeah, everybody loved Dave.
Yeah.
I
love Dave. By the way.
I just the bonding of people and getting
Yeah.
to know people.
Yeah.
I thought that was really cool. Also discipline,
Mm.
because I had never studied like that in my life,
Yeah.
right? Especially for the exams.
Yeah.
What's the last exam you take? The licensure exam,
Yeah.
and then whatever
Yep.
exam we took. But there's that discipline, which I already had discipline for the martial arts, but that took it to another level.
Sure.
Which is what you need in business, right? I mean, there's a lot of things you do in business you don't get paid for,
That's right.
right?
That's right.
And then you have to keep coming.
That's right.
But I think that was I'm really big on once you spend so much time with people, the bond that you have with them
Mhm.
doesn't break.
Right.
You know what I'm saying? I mean, we haven't.
I would agree.
We've maybe talked online a little bit. But
Yeah.
we graduated 2009. It's
I know.
3.
I know.
It's at 14 years.
Yeah. Yeah.
So I was like, hey, Chad, we did a podcast. They're like, yes.
Let's go.
Right? And we were like,
Yeah.
you do? I was like, no, I'm going to drive up.
Yes.
My
I love
2-hour
it.
drive.
I love
whatever
it.
is.
I love the in-person stuff.
You know what I'm saying?
Yes.
But here's what I want to ask you. Relationship-wise.
Yes.
So me and you lead totally different lives.
Yeah.
You've been with your wife for how many years?
Oh man. Yeah, about 14.
Okay.
Yeah.
I have trouble making it past a year and a half.
Yeah.
Right? Well, what I want to ask you is how cool is it to be with the same woman, have 2 children,
3 children.
3 children,
Yeah.
married to the 3rd.
Yeah.
Um,
You could think it's 2 because there were one set of her twins, so it only happened twice. You know what I mean?
how cool is it to have her through your life for those 14 years? Because this was you were in PT school.
That's
together,
right. We were.
right? And to go up and have your business, just speak to me of that
Yeah.
bond.
It's great, man. She works here part-time too, which is even greater, which has been great to have her on my side. She's been my biggest supporter, man, like with the whole business stuff. And that was one question that I asked her. I said, listen, if I'm going to do this, I'm going to need your support. Like if I'm not going to have it, then it's not going to work. I'm not going to do it, And I'm going to be honest, like it's not easy. Like whoever's listening to this wants to start a PT clinic or a business in general and has a spouse, there's going to be hard times. It's just what it is, and you have to find the balance between work and life. It's not easy. I have a hard time with it still, I think it took me probably the first 5 years of my business to find some sort of balance, where I was like, okay, I need to leave a little bit, spend time with the kids, whatever it needs to be, right? Or like nowadays we have, my wife and I have a quote unquote feelings meeting, which happens every Wednesday. And that's actually, that's a conversation that I had with Kelly Starrett about 1.5 years ago. And I was like, Kelly, I don't know what to do, man. Like this work-life balance is tough. He goes, dude, we have feelings meetings like 2 times a week. You gotta schedule it out and just do it. And I'm like, all right, I'll give it a try. We'll see what happens. And we did it. And we've been faithful with it. We do it, and if we don't do it on Wednesday, we'll do it on a Friday. You know what I mean? So it's like, it's like when the kids go to bed, we just sit there and say, hey, how was your week? You know what I mean? You have to block that time out, because if you don't block it out, stuff just festers and it just doesn't work, Yeah. So I would say that's the biggest, if I could give anybody advice, like not only do you need the support from your spouse, but you also have to like create that balance. It's very easy to lose it.
And how cool is it to share those moments with it, right? So
it's amazing.
The reason I ask is because like, I've dated different people, during PT school.
Yeah.
Well, one during PT school, after and now. So I've had different experiences and be able to share different moments with different people.
Sure.
Right. So my experience was totally different. But I mean, I'm not saying either one is better than the other.
Yeah.
But I also, in some instances, think it'd be really cool if I had that same woman for the 14 years who would like, this was Marc, right?
Yes.
You know what I'm saying? And can you speak to me to that, to have Katie with you the whole 14 years to be your supporter, because a lot of the stuff I do, like this podcast, like, okay, maybe I'm dating somebody or I'm single, right? So like you don't have that person right by your side.
It is cool. And you know what? Like it's nice because I like to bounce things off of her, you know what I mean? And she may not be 100% in the business like I am, but the advice that she gives me sometimes is invaluable. I'll be like, damn, I haven't thought about it. Because you have to ask for the advice. You know what I mean? You can't be too proud. And I do believe that like over time, like we've evolved like crazy. You know what I mean? I've changed about 1,000-fold from when I was in PT school when we were still dating to, now 14 years later, 15 years later. So it's watching that evolution and like thinking about the times that we've gone through, and you look back on it, you're like, oh, it's pretty cool. It is really cool, when you think about it.
But, have you ever thought about it?
Yeah, we do talk about it occasionally. You know what I mean? But sometimes it's like we talk about I'm glad that's over. Or sometimes we talk about it like it's just like, wow, look at how far we've come.
Yeah.
You know what I mean? And that's those are the coolest stories to have. You know what I mean? When it's, I used to work
together, right?
Yeah.
Did you think this podcast is going to get all emotional and feely?
No, I love it. Because you know what though? Like this is all part of it. Like this is all, in terms of the business stuff, like this is one of the I was in a mastermind for 2.5 years and 3 years almost. And in that, the conversations that you have, most of the conversations are about the relationships that you're going through, like the stage of the business, but also dealing with everything else around the business. Cause not everybody gets it, right? Like
you said to me when we were doing the podcast, it might be on camera. You're like, I feel like I could talk to you.
Yeah.
Right?
Yeah.
I knew exactly what you meant because unless you run a business,
you don't get it.
You don't understand. It's not your fault.
That's right. Nobody's blaming you for that.
But it's a different life.
But it can be lonely at times, right? Because if you don't have anybody else to talk to about certain things, and if you don't have a network that you're a part of, it's a lonely life. You know what I mean? So like that's why you need to get yourself involved in a network like you're involved in.
Yeah.
Like
So
I'm involved in. So
so I'll plug it. I do Gym Lunch.
Yeah.
Which is Alex Hermose's.
Yep.
The Prestige Labs is also his supplement company. And I was telling you the reason I got into it. Like, okay, I was a physical therapist. I was a black belt martial artist. I had like this pseudo business. I'm like, I'm going to figure this out myself.
Yeah.
Right. Like super ego,
sure,
proud. And COVID had just hit. And I was like, I know exactly what to do. I'm going to add more classes. And I had knew of Alex Hormozi through Russell Brunson ClickFunnels.
Yeah.
And I was like, I'm not going to forget that guy. And I remember, okay, I add more classes. I saw a video of his, and he was like, the one thing you don't want to do right now during COVID is add more classes.
Yeah.
And I was like, well, this is the guy who's already made it, multimillionaire. You know, I'm running my little studio. I should probably sign up. One of the biggest benefits for me is connecting with other gym owners around the world and being able to talk to them. I did a podcast with Raina Horderman the other day. I have my group calls with my coach. And I have, some side conversations on Facebook. With other kickboxing schools. What are you going through? Right. And that's the biggest thing because like, there's been some times, man, where like, I remember in Rhode Island, I didn't realize this. We had gone through COVID. Another cool thing I can say is because of my integrity, the way I was raised, like everybody who paid me during COVID would either got reimbursed or was made even somehow. Right. And it was like, after that, they were thinking about going back to the mask. Now, one of the big things for fitness is nobody wants to work with the mask,
right?
Which I totally get.
Yep.
What does that mean to my memberships?
Right.
They're going to cancel.
That's right.
And they didn't end up going back to mask. But as they were thinking about it, I was like, oh my God, like I'm really anxious right now. And I was talking to Rhiannon, and she's like, yeah, you had PTSD from that.
Yeah.
I was like, I did.
Yeah.
Right.
Yeah.
And I was able to talk to my coach, and he basically had talked me off a ledge, so to speak, because I was like, I don't want to go through this again.
Yeah.
Right. I handled it fine.
Yep.
But like the thought of losing all my members again.
Dude, scary times, man.
But if I didn't have that or be able to navigate or, I was talking about my business the other day on a call and my coach was like, just do this. And I was like, oh, okay. Yeah.
Seriously. Exactly. Like it may not be simple to you. You need to have somebody on the outside looking in and be like, no, it's just like, it's a simple solution. You know what I mean?
The best coaches have coaches.
That's 1,000%.
Right.
I'm a coach, but I also have a coach.
Yeah.
I have a coach that does my programming and nutrition, and I have a coach that helps me with my business.
Mm-hmm.
You have to.
Yeah.
You can't do it all on your own.
Well, I think with that, that's, your physical therapist is a coach. Your fitness trainer is a coach.
1,000%.
You pay for results.
That's right.
And it expedites you.
Yep.
Right. You either pay money to fast forward or you just pay in time.
And I think some people I think look at it as a sign of weakness, and it's not. Like you're not asking for help because you're weak. You're like, I just want to be better.
I think it makes it stronger.
I think so too. And I think you gain respect. I only gain respect from my clients when they're like, wait, you have a coach? I'm like, yeah, I have a coach. You know what I mean? Like every coach or a good coach should have a coach. You need it.
And in different areas.
And my coach has a coach.
Yeah.
It's just how it goes.
Yeah, I think that's super important.
And you will learn things from your coach, you know what I mean, that you can apply to your clients. You know what I mean?
This is the biggest thing for me. Like after I do a podcast with somebody, I change a little bit. Yeah. And I notice they change a little bit. Right. Because I can see it. They say stuff. I was like, we talked about that. Right. Which is super cool.
Fun.